In Arizona, we pride ourselves on outdoor lifestyle, but chronic pain can make it difficult to enjoy a hike or even complete everyday tasks. But there's a treatment that may provide you with long-lasting pain relief. Today, we're at Mountain View Headache and Spine Institute to learn more. Joining us now is Dr. Gupta. Thank you for inviting us out today.
Welcome to my clinic.
Okay, so we want to know about this treatment. Tell us more about it.
So ketamine is an anesthetic drug that we've used in clinical anesthesia for over 50 years to help patients get through painful surgery. What we've learned in the last 15-20 years through research is that if administered as an infusion, it can be very effective for chronic pain.
Okay, so what types of condition does ketamine treat?
It can treat many conditions. It's very helpful with fibromyalgia, chronic fatigue syndrome, shingles pain, nerve pain that hasn't really responded to epidurals or ablations. Cancer patients also benefit from ketamine.
Okay, well, it has a lot of uses there, right?
It definitely does. It's in the right patient as part of a multimodal approach to pain management. It definitely has a role, and I don't think it has been utilized to its fullest capacity.
Okay, so can we see how this works?
Absolutely. So this is one of our exam rooms.
Okay.
We'd have you sit over here. There's an infusion chair, it reclines. We attach you to one of these monitors. These are the same monitors that are used in hospitals. We start an IV on you, and this is just regular IV fluid. And we're going to attach ketamine to your IV fluid through a smart pump. And over the course of an hour, you should be getting really good infusion of this medication.
How many sessions does a patient usually need?
I would say most patients get between 4 to 5 sessions. And then depending on how severe your condition is, we may do more. We do a follow-up visit. And if you are okay, you're feeling much better, then you may need a booster infusion at the 1-month mark or the 3-month mark. Initially, I do it between 4 to 5 infusions.
And when do they start feeling the results?
I would say after the very first infusion, your pain will 100% go away, but it's going to come back.
Okay.
It won't be until the 2nd or 3rd infusion that you're going to notice that things are moving in the right direction. And it won't be until the 4th or 5th that the relief will be a little bit longer lasting.
So is each session about an hour?
I would say that by the time you recover afterwards, all of that takes combined about 2 hours.
So if someone was coming during the day between work or maybe like a lunch hour, are they able to go back and return to work or their daily activities?
It depends on the patient. I would say most patients do go back to work because a lot of our patients are full-time workers. So we try to work around their schedule. But we do say that don't operate any heavy machinery. So if your work involves driving or operating a machine, then we would say don't do that.
Okay, perfect. Good to know, right?
Absolutely.
So are there any side effects with the ketamine treatments?
So, as with any medication, there are side effects, but I would say ketamine is a lot safer than most of the other medications that we have because we are administering it in a controlled setting as an infusion. So side effects are, there's a side effect of nausea. So we give everybody anti-nausea medicine before we even start the infusion. And that usually is sufficient for that. Ketamine can increase your heart rate and blood pressure, but at the dose that we give it, it doesn't really happen. That's why we also have the patient on a monitor, so we can pick it up right away, adjust the dosage. It isn't addictive. So there's no such thing as, once you get some ketamine, you're going to need more.
Okay.
It's not like that.
Perfect.
And you're not going to overdose on it. So in many ways, it is a very safe drug.
So what is the cost for this type of treatment?
Well, that's the best part. Because we are a pain management clinic and we are using it for specific indications, we are able to get insurance coverage for this. So I would say we do about 15 infusions a day, and I would say 1 infusion every 2 days is not covered by insurance. All the rest are Medicare, the major commercial insurances, and if you have any questions whether or not your insurance covers it, you can always call the office and we would be happy to guide you.
All right, perfect. So is there anything else that our viewers need to know about these types of treatments?
I would say that, ketamine, I think, has gotten a negative rap because of, the way it's been presented in our society. But any medication, if not administered the right way, will have negative effects. I think if administered the way it was meant to be, in a controlled setting for the right indications, ketamine can be very effective for treatment.
Perfect. All right. Thank you, Dr. Gupta, for inviting us out today and for sharing this information with us. And if you want to learn more, visit mountainviewheadacheandspine.com or call the number there on your screen.